Tonight, we begin with the story of a 28-year-old doctor who this afternoon lost the fight to the coronavirus. Dr. Stephen Mogusu had been at the intensive care unit of the Kenyatta University hospital when he succumbed to the very disease he helped save patients from for months. Dr. Stephen had recently expressed how vulnerable he felt, having worked at a COVID-19 isolation unit, and unfortunately, his greatest fears came to pass. His death comes at a time when doctors around the country are fighting for their rights in the front line as the KMPDU suspended their strike that was to start today. Anita Nkonge with the details.
28-year-old Dr. Stephen Mogusu has succumbed to COVID-19 this afternoon. He was infected with the virus from a close contact at an isolation center in Machakos that he had been posted at since August this year. After a selfless service to COVID-19 patients under the Universal Healthcare Coverage Program, Dr. Stephen had not been paid for 5 months. He fell ill around 3 weeks ago and had even been admitted to the high dependency unit and put on an oxygen machine at some point. On Saturday, he was admitted at the intensive care unit, but lost the fight to COVID-19 Monday afternoon. He had no insurance cover, and his family has been left with a hospital bill of over 850,000 shillings. Dr. Stephen leaves behind his wife and 5-month-old baby. This is the face of the sheer neglect the government has treated the plight of doctors with. Just yesterday, the KMPDU called off their strike that was to start today for 14 days. There are ongoing talks with the National and Senate Health Committees.
Ulikuwa mkutano mrefu sana wa masaa 6, lakini baada ya saa 6 tukawa tumekubaliana kwamba huu ndio mkondo tutakaochukua kwa sasa hivi. Kwa hiyo ni kusema kwamba serikali pia walikuwa wamesema wanahitaji huo muda. Kwa hiyo tunawapatia huo muda.
The KMPDU maintain, however, that the strike would commence on the 21st of December if their issues remain unresolved. They went on to advise their colleagues not to endanger their lives if they're not provided with adequate PPEs. Advice that is a bit too late for Dr. Stephen Mogusu. In a message sent to his former classmates at the University of Nairobi, Dr. Mogusu asking them to save their lives. My dear colleagues, let me take this opportunity to admonish you today to get your pay or get out while you can with your health or life intact. I will say not even a full pocket can replenish what has been lost in high O2 flows, all manner of masks, and begging for one more gasp of fresh air. Usually I'd write and write, but today I just want to save your miserable selves from those institutions you live to earn again. Save yourselves. Meanwhile, Health Cabinet Secretary Mutahi Kagwe is on the spot for a failure to authorize the Kenya Medical Supplies Authority to sell personal protective equipment at the current market price. The acting CEO of KEMSA, Edwin Njoroge, informed the Senate Health Committee that KEMSA was currently selling a total of 115,000 PPEs at 9,000 shillings each instead of 4,500 shillings per unit. As this happens, Busia Governor Sos Peter Ojamong gave what could only be described as a ridiculous comment to doctors.
Kama madaktari, nurses, clinical officers ambao wanataka kugoma, hata ukigoma haitakusaidia. Tukae chini tuongee. Mwambie hii watu ya health bwana, mvumilie kidogo mpaka hii BBI ikwishe, kama italeta vitu mzuri alafu twende mbele.
Anita Nkonge, NTV.